Thank you. I'm going to highlight and talk just a little bit about the healthcare side of the issue and the concerns that we have. As you know, last year in the budget, it was announced that there was this creation of this new healthcare plan that was going to help cover undocumenteds now from age 42 and older, providing them what is the finest health care in the country. It is better coverage than we give our own disabled, that we give our own low incomes families, and certainly much better coverage than what working families that have to pay premiums and co-pays and deductibles for their health coverage. It's a substantial amount. And the concern is that up until January, Illinois was the only state that provided unlimited health care. And so not only were we have millions crossing the borders into the states, but there are only 11 sanctuary states in the country. There's only 2 in the Midwest, Illinois and Colorado, and Illinois was the only state that provided that free health care. Now, January 1, California announced they're going to start providing health care, so that may give some relief. But not only is Illinois seeing this influx, but we are getting the sickest of the sick because we're the only state that covers for this broad health coverage. In the budget, they had talked about the cost being somewhere around $800 million just for the program for those age 42 and older. But in addition to that, we already cover children from birth to 18 under the regular Medicaid program that undocumenteds qualify for, that the state picks up half of those costs. And also, all undocumenteds that go through the emergency room, half of that cost is paid for by Illinois taxpayers, regardless of their age. And so the number that we're providing for health care alone is well in excess of $1 billion a year, which is something that our budget can't handle. And at a time when our disabled community, our seniors, our veterans are all struggling with affordability of their health care, for the state to be spending this kind of money to provide this kind of care is not right. And again, we believe that this is something that, one, should be addressed at the federal level, either close the border or the federal government should be paying for this health care, not asking Illinois taxpayers to pay this huge number that is growing each day as more and more come into the state. So that's a concern that we have and we believe needs to be addressed. And this legislation is one of those that sends a message that Illinois is not the sanctuary state to come to for free health care from residents from over 100 different countries that come here, knowing that, as I said, up until January, Illinois was the only state that provided broad health care. And so that unfortunately helped attract a sicker population as well, which again was costing the state taxpayers significant dollars. So thank you for allowing me to talk at least about the healthcare portion of it.